Welcome back again. This is segment 3 in Unit 8, Infectious Diseases, of a 5-part series of mini lectures covering this topic that really is one of the critical or pivotal sections of the whole course in infectious disease. So let's talk about disease classification in a little bit more detail here. So the textbook gives you an acronym, as oftentimes is useful in helping you remember certain things. That disease can be categorized or classified using this MAD-10 acronym as either metabolic anomalies, which would be weird things like what's in the picture here of a kind of a two-headed calf, degenerative, trauma and toxins, infectious, immune, or idiopathic, and neoplastic and nutrition related. So there's a lot of different things here that they could categorize. And so as we work with veterinarians, or as we are managers of a livestock operation, or just troubleshooting things with our companion animals, it's helpful to be able to understand where a disease may fit in any one of those categories. So when we talk about disease in clinical practice and clinical signs, first we need to be able to have an idea how to do a physical examination, especially understand what the vital signs are: the heart rate, the respiration rate, and body temperature, and how to evaluate them and what's normal. Then you can start doing diagnostic tests, or your veterinarian may be helping you conduct some diagnostic testing. They may look at some blood chemistry or a CBC, complete blood count. They may do a urinalysis or even a radiograph, an x-ray like what is pictured here. So let's talk metabolic disease for a little bit, the first one of that acronym. Some endocrine diseases that are related here are like diabetes, hypothyroidism, or hypoadrenocorticism, easy for me to say, right? All endocrine related diseases that can be caused by imbalances metabolically. How about some anomalies? Well, I showed you a picture early on. Here's another diagram or graphic that comes out of your textbook. Whenever these anomalies occur, sometimes there's not really any clinical symptom or problem. It's just something odd that happens. Sometimes an animal may be, a pregnant animal may abort or have a stillbirth just because of that anomaly setting in. Some of them may set in as the animal develops. Of course, there's some genetic things that can be tied into here to some of these anomalies, or it could just be a simple defect in fetal development. Something strange happened while that animal was developing in utero. Degenerative diseases, of course, oftentimes associated with aging, with normal wear and tear, and arthritis and disc diseases, kind of good examples of some musculoskeletal problems that may break down, arthritis setting in some of the joints and so forth. Trauma, of course, oftentimes a big one that you have to deal with. Broken bones, accidents of some kind, extremely common in veterinary practice. And of course, understanding how to do some basic first aid is quite helpful. Here, the same principles that we're talking about that you would utilize in human first aid would be also important for animal first aid. And if you have internal damage, of course, sometimes we can require emergency surgery. And then peritonitis is where we get infection within the peritoneal cavity. So that space outside of your digestive tract area, in the stomach region, that is all filled by fluid and other different things. And if we get some kind of trauma with, which may, let's say, tear a small intestine, or get some of that fluid leaking out into the peritoneal cavity, that of course then causes infection, which is quite nasty to deal with, and really can set an animal back or heading towards death quite rapidly. Trauma and toxic diseases, as we deal with toxicities, of course, we can have animals that ingest certain things that are toxic, or inhale it, or come into contact with some of those things. Signs of toxin, kind of some symptoms, and we'll hit on some specific ones later on in some different units. But of course, you can see skin irritation, vomiting and or diarrhea, breathing difficulties might set in. Of course, we know that things like antifreeze are very, very poisonous to companion animals, specifically dogs. And so if they've been exposed to a little bit of it, you want to be right on top of that, and hopefully you're able to save them from any further problems. Make sure to understand, what particular risk factors that you have with regard to toxicities around your home or in your barn. Understand those household cleaners, over-the-counter prescription medications, certain plants, other animals that might be around, such as toads that carry a little bit of a toxic mucus around their skin, other foods that can cause toxic reactions. Very critical to understand what is problematic for both livestock and companion animal species that you have around your operation. So neoplastic or tumor-related neoplasms, and of course specifically we're talking about cancer here, are divided into two major categories. Benign tumors that only expand locally, sometimes are not that problematic, can be removed without worry about that cancer metastasizing and spreading through the rest of the body, or malignant neoplasms that are extremely, extremely destructive and invade not only the surrounding tissue but can spread throughout the body relatively rapidly at different times. So be aware of those problems, of course. Benign tumors, again, even though they can be quite damaging, oftentimes they don't spread, like I mentioned. And so understand that terminology is descriptive to the origination of the tumor and how it is predicted that it may affect your animal, and therefore would dictate a lot how you treat them. Nutritionally, oftentimes you're going to see a ton of overlap here, nutritional with metabolic diseases. The distinction between the two classes in this text, I would suggest, is not very clear. So it's kind of hard to split the two, in my opinion, because oftentimes if you've got a nutritional problem, it will manifest itself in a metabolic manner. So if you are, for example, in ruminants, underfeeding the amount of fiber in the diet, that's a nutritional problem. It's going to manifest itself in a acidosis response because that ruminant doesn't have enough fiber in the gut. She'll have a metabolic problem that will likely result in something like acidosis or a DA or both. Those are metabolic disorders. So it's important that to feature this class of disease, it's considered a differential diagnosis. So understand what the interlink is between those two potential problems. So again, we'll wrap up this third mini lecture series. Take another break, and we'll pick up with the next section briefly.